Okay. Hello. Good morning. First and foremost, I would like to thank the organizers of MLab for doing an excellent job for public education. I'm actually from the UMS Specialist Center and representing the SDSM or Sleep Disorder Society of Malaysia. I'm very honored to present a topic which is pretty close to my heart: how disrupted sleep drives obesity and diabetes. Now, let's talk more on the local context of things. I'm going to discuss about three things, just three things. The first thing I'm going to discuss is how sleep deprivation, a bit of OSA, on how sleep apnea affects us systematically. I'm going to dial down things to something more simpler so we can bring back something. The next thing is to talk about how sleep deprivation affects obesity. And last but not least, a lot of people ask me this question and ask me to share. What do we do in a sleep clinic and how do we manage these kind of cases? How do we convince them to start? Because as you know, how do you look for a sleep specialist in Malaysia? It's not easy. So we want to share what we do in the clinic day to day, and hopefully we can educate people on what we do as well. So before I start, when I was given this topic, I actually was a bit confused on what I should speak about. So what I did was, I did the laziest thing I can do. I went to ChatGPT. I asked them to illustrate what is sleep apnea, what is sleep deprivation. And this is the pictures I got. As you can see from the pictures here, what we see is someone sleeping. We can see there's a red sign here. I did it 3 times. And we can see that this is how artificial intelligence actually, they describe sleep apnea. And I believe that information is jumbled up, it's all over the place. And there's a picture of the heart, and there's a picture of the lung, everywhere. So how does this translate into something that we can understand? So even artificial intelligence is not able to tell us the good picture at this point of time. So before I proceed even further, I would also like to let you know that when you talk about sleep deprivation, it's not just about sleep apnea. There are many more sleep disorders that are associated with sleep deprivation, such as insomnia, which is one of the commonest, or probably the commonest sleep disorder in the world, not just sleep apnea. Okay, central sleep apnea, we have narcolepsy, we have circadian rhythm disorders, restless leg syndrome, and parasomnias. And of course, everyone, if you travel often, you have jet lag as well. So there's so many causes of sleep deprivation, and we shouldn't just pin them down on sleep apnea. Now, I think Professor Iyad has already mentioned this many times, but I believe that it's time for me to mention again. Remember that sleep deprivation isn't just about poor sleep quality, it's also affecting your life. And I would like to just divide them into 3, okay? The 3 things you must know: that it affects your heart, it increases the risk of heart attacks, heart failure, hypertension, it increases the risk of stroke and dementia, it can cause depression. I've also did a study that shows that there's a lot of marriage dispute that can happen, loss in job, and very importantly, something that we're working with the ministry, the risk of motor vehicle accidents. And this is important. How do we quantify? Of course, in numbers, there's an increase of risk, 37 to 50% chance of increase of diabetes, hypertension, heart problems, and very importantly, as what Professor has mentioned just now, it's almost a 3 times fold of developing stroke. And this is important because you might develop a risk of dementia in the future. So, if you look around the world, it's very much clear, and it's very true in Malaysia as well. If you can see from here, it's about 5 to 15% of the population actually develops some form of sleep apnea. So I think that it is a health concern and we must address it. So it's so much of a concern that the American Heart Association has put sleep as one of the life's 8 essentials. And it is recommended that we go at least 7 to 9 hours of good quality sleep every day, ladies and gentlemen. So, effects of sleep deprivation, you can check it out online or you can go for any literature. We can see that profound effects on many organs in the body. For example, it can cause cognitive impairment, memory lapses, impaired moral judgment, hallucinations, lymph node, systemic immune dysfunction, risk of type 2 diabetes, which I'm going to talk more in detail, heart rate problems, muscle aches. I think muscle ache is important. People wake up, they feel very sore. Probably they're not getting a good night's sleep. Quality of sleep is very important for that. And of course, it suppresses a lot of issues, growth suppression. If you're children, you will notice that they don't grow well, they don't gain much weight. It is probably because of sleep deprivation. For example, sleep apnea, we have big tonsils that can actually lead to that. And actually, back to the context of local, if you can look closely, this is just articles I picked just last month. How many incidents of micro-sleep has led to so much accidents around us? And it's not affecting just us, but the people around us. And this is important for us to treat. Remember, we don't want to get anyone involved in our health disorders. But unfortunately, it is a nationwide pandemic. And ladies and gentlemen, we should address it. And we appreciate that the organizers today raise awareness, especially in the public sector. But the question now is, we know about microsleep. How about other issues of sleep deprivation? And this is where my topic comes in. We're talking about obesity and diabetes. Now, the thing about sleep apnea and sleep deprivation, what actually leads to all these issues is two things. The first thing is oxygen desaturation, whereby a decrease in oxygen multiple times in the night and even a deep desaturation will lead to increased inflammatory cytokines. These inflammatory cytokines are not healthy for the body. It causes a lot of issues, and one of them, the important, is decreased insulin sensitivity, which will eventually lead to diabetes mellitus. And next thing is your increased cortisol. Cortisol is actually your stress hormones. It increases your weight. Okay, so these are the few factors. And this is something which is not known. It increases a hormone called ghrelin, and that promotes hunger. And unfortunately for Malaysians, one thing that we like to do, more than a lot of countries, we like to eat. And now Bulan Puasa is coming, or the Ramadan period. A lot of bazaar is open. So we can see that more obesity leads to more sleep apnea. Sleep apnea will lead to more sleep deprivation, and more sleep deprivation will lead to more obesity. And it goes round and round and round. So, as you can see from the study done by Pepper et al., we can see that any 10% increase in BMI will lead to a 6-fold risk of developing sleep apnea, ladies and gentlemen. And this is not a no number, it's a huge number. Okay? And as we have written here, so many articles, so many memes, and so many Instagram posts show disturbed sleep is a risk of obesity. Okay? So please get good quality sleep every day. Remember, in your busy life, I know everyone is busy, they're traveling overseas and whatnot. Please make sure you have a good night's sleep. Okay? So if you don't, you might gain weight and you might develop sleep apnea in the future. Now, as we all know, I need to show this picture because as you know, the holy month of Ramadan is here. A lot of bazaars are opening. We like to tap out the food, go home. And fantastic food in Malaysia. Professor, you should try the food. So plenty of food. Everyone, please enjoy. Please enjoy the food because it's fantastic. But don't do it at night before you sleep. If not, you'll get a lot of sleep apnea. Then my clinic will be overloaded. Okay, so please enjoy the food while you're in Malaysia. But remember, practice good quality of sleep. So as we also know, we also have people that have a very busy lifestyle, short sleepers gain weight over time. This is an important graph, ladies and gentlemen. Please remember, the shorter you sleep, the more likely you will develop obesity. And I've also did my part in mentioning into media, as you can see from here. Now, we talk about food and how it affects us. Remember, food is fantastic here. My God, if you look at the pictures here, it's just tempting, But please control ourselves, It will lead to worsening sleep apnea and worsening obesity. Okay, so the function of good sleep is not just about obesity. Remember that it increases our energy, increases our physical health, improves our memory, improves our stress management, improves immunity, and improves concentration. Ladies and gentlemen, it is so important not just about obesity and diabetes, but all of these factors as well. Okay? Now, what do we do? Now, the next question, my final topic, will be to discuss what does a sleep doctor do? What do they just talk to us, or do we give them medication, or what? So here, ladies and gentlemen, here to discuss and share a bit on what we do. Now, majority of patients, about 80 to 70% of our patients actually come to us with sleep apnea. Of course, there's another 20 to 30%, and our role is very simple, to break the cycle. To break the cycle of sleep deprivation, to treat the underlying cause. So what we do, if you have a problem with your sleep, if you feel that you don't have enough sleep in the morning, you don't feel refreshed, you snore a lot, or you have some form of medical disorder that is associated with sleep, what you should do, the first step is to consult a sleep specialist. Look around, speak to your friends and family. They will probably know someone. You can go to Google and search plenty of sleep specialists around. But go to a properly equipped center that has all the facilities. So what we do is we get a detailed assessment of your sleeping habits. And if it's sleep apnea, what we do as an ENT, we do an upper airway assessment. If there's a respiratory physician, we will counsel you for CPAP, PEP therapy. And if it's endocrinologists, we counsel them for weight loss. And of course, the list goes on. Family medicine specialists is also play a role in sleep hygiene. Now, the next thing we also do, if indicated, will be a sleep study. Let me just brief to everyone. This is actually my team from the University of Malaya. As you can see, we are a huge team. We have a group of dentists, we have a group of respiratory physicians, we have endocrinologists, obesity specialists, of course, we have good support from our management teams. We do a proper airway assessment to one of our patients here. We do imaging, we do CT scans. This is how detailed we go to find out about how we can break the cycle of obesity and, of course, sleep apnea. And we're looking about in-lab polysomnogram. It's not for everyone, I must agree. It's indicated for certain conditions. Now, this one is a huge story. I think we can discuss a bit in detail when you meet the consultant. And of course, for patients who are high risk of sleep apnea, or what we call a low pre-test score of sleep, the stop bank score, we generally do a home-based sleep study. And it is much cheaper compared to an in-lab study. And I think in most cases, most of our patients who are obese and they have symptoms of sleep apnea, we generally go for home-based sleep study. Now, how about number 2? This is very important. A lot of people ask me, sleep hygiene, what is sleep hygiene, Okay, the thing about sleep hygiene, why do you give sleep hygiene for patients who have sleep apnea with a blocked throat? The short answer is very simple, because it actually reduces the symptom, it improves the symptom, even with CPAP or without treatment. So, people ask me, hey, sleep apnea, what? You go to shower when you sleep, So I take this picture, or you put a shower when you sleep. What is sleep hygiene? Sleep hygiene is a fancy term to describe when you go to sleep, and you wake up at the same time every day. We prefer not to wake up at the wrong time. You make sure you sleep at 10 to 12, wake up at about 6 to 8 o'clock. That will be very important. The next thing, we need to establish a nighttime routine, which means that when you have certain activities, you make sure that you do it before you sleep and do not overshoot. Okay? Don't drink coffee. And as the Italians like to say, we do not serve coffee after 2 p.m. So try your best not to drink coffee after 2 p.m. Exercise regularly, reduce your stress. If you're living in a stressful environment, don't work in toxic environment and don't think about work. You go back, please do not think about work. Okay? And avoid, this is difficult for Malaysians. Avoid large fatty meals prior to sleeping. Okay? Turn off electronics an hour before you sleep. Remember, don't play phone, no TikTok, no Instagram, please. Okay? And finally, create a healthy sleep environment. If your room is hot, switch on the aircon, keep temperature at 25 degrees, make sure your bed is flat. Bed ergonomics is very important. Get a good pillow, get a good bed. So it's very important for practicing sleep, good hygiene to make sure that your quality of sleep is good. And step 3, of course, to break the cycle, the main treatment of sleep apnea has to be treated. So actually, in where we practice, we actually generally recommend either of these 4. We have patients, most of our patients, about 50% of our patients actually do well with CPAP therapy. And then a patient who has structural issues like tonsils or turbinates, or even there's a laxity of the palate and they cannot tolerate CPAP that well, surgery is an option. Oral appliance, if patient have mild to moderate OSA, if they have a very short jaw, that will be an option for them. And of course, positional therapy. If we see from the sleep study, you're very much dependent on position, that is an option. So pictures, I think Prof has already mentioned just now, we can see pictures of the CPAP and how it actually enlarges and dilates the airway to give you more air to breathe so you can obtain a good quality sleep. But bear in mind, sleep hygiene must be there as well to complement this. The next thing is surgery. If let's say there's a structural issue, we need to deal with it. Otherwise, CPAP might be a bit difficult as well. So I think I've also seen some products outside. They have peak flow and these strips that you can put in your nose. Those are actually indicated for people who have nasal valve collapse. So if nasal valve collapse, it actually helps a lot, So deviated septums, turbinate hypertrophy needs to be assessed by a specialist. And I think that's very important to be done by a sleep specialist as well. The next thing is oral appliance. Very popular option. As you can see, it's been marketed very well. It's indicated for certain conditions like a very short jaw, people who cannot tolerate CPAP. But we always start with CPAP, we give them a trial first before we begin with any other options. And last but not least, of course, positional therapy. People ask me, how do you maintain the position at some point? And I generally tell them, do you see the pregnant woman? You see when their tummy is big, what do? We give them the C-shaped pillow to make sure that they sleep on one side. And you can see there's and you know those uncle that like to wear the flannel bags, they actually twist it to the back and then they sleep. That also keeps them at a certain position. So that's another option that we often tell our patients, to keep them sleep on the side, especially on the left lateral side. Okay, and step 4, of course, we don't forget the main issue, which is sugar control and obesity. Now, we're talking about regular visits to your sleep specialist, your family medicine, and of course, your diabetes specialist to make sure your sugar is well controlled. And as you can see from here, it's so important to monitor your weight. If you are at a BMI above 30, please make sure you have a certain target. And we generally recommend about 10% of BMI reduction within 3 to 6 months, or we will escalate the treatment to medication or even bariatric surgery if it's worst case scenario. And we can see not necessarily you need to go for not so extensive exercises. We have options like meal replacement therapy, which you actually try. And I think what's important here is motivation. Family support, motivation, and what's important, it comes down from you. If you believe you have an issue, we always believe that you should work on it and you should try your best to lose weight. Okay? And ladies and gentlemen, by that, I'd like to thank you for your time. Thank you for everyone, and of course to the organizers. Thank you to the organizers once more. Thank you, Professor, for your insightful talk. And I would like to encourage everyone, please continue the battle. We need to spread awareness of sleep to everyone we know, because it saves life, save your own life, take care of your family, and most importantly, as a nation, let's move forwards. Thank you very much.
All right, once again, please give another big hand to Dr. Julius Goh Liang Chai. Thank you very much.